I'm joined today by McMaster expert Dr. Teresa Chan to share some top ways you can use social media to increase health literacy. Dr. Chan, you recently won an International Teaching Award for your work on how social media can be used to increase health literacy. Can you share with us some of your top tips for health professionals on how they can utilize the powerful tool of social media?
I think that when you're entering into the space of social media, I think it's important, first of all, to understand the nuances of each of the social media platforms. So for instance, on LinkedIn, you have to know that you can post longer materials. You can have more than just a few lines, but only those first couple of lines can be seen above the fold, as they say. You got to make sure that that's really catchy so that when you click the line for read more, people want to do that. I think the most important thing is to think about what your target audience has in mind for where they're going to learn, and then go there. Sky's the limit when you're trying to reach different groups. On Twitter or Mastodon, you might want to engage in polls or tweet chats, and then think about like having threads or posting infographics and videos like this one. Each time you engage in a different way, I think you reach a different group of people. Now, if you're a scientist or a clinician who's engaged in research and you want to reach your research colleagues, it's useful to still use graphics and other fun ways to engage your audience so that they're interested in the work that you're doing.
It's certainly valuable to learn what we should be doing. Is there anything, however, that health professionals should avoid doing on social media?
Oh, certainly. I think that we have to always remember that we're professionals first, and that e-professionalism can be really important in this space. When people can identify you as a health professional, you have to remember that they're going to trust your content in a different way. These are public spaces. And so I always think about it as if you are going to say this on a big stage, and if there was to be a hot mic, would you say the same thing? And if you would, then I would say then that's probably okay. But if you would be embarrassed if your mom was in the audience watching you give a big speech and you're about to say the same thing, then maybe think twice. There are some really important things to remember around patient confidentiality, laws, and policies. You also have to be wary about making sure that your patient cases that you talk about can't be traced back to the patient. Sometimes time and date and location are enough if someone can triangulate from headline news. In Canada, luckily, gunshot wounds are not that popular as a pathology within the emergency department where I work. That means that if I talk about someone being shot on a specific date or time, people could probably figure it out the next day on the news.
Thank you very much, Dr. Chan, for sharing these tips on how social media can be used for both knowledge translation and education. I look forward to implementing some of these suggestions myself.
Thank you very much.